Hi, my name is Kale Evans. I'm a student nurse here at Wilson State College, and today I will be demonstrating the skills of assisting a patient with a bedpan, administering suppositories, administering a enema, and changing an ostomy bag. So the first thing that I'm going to do is I'm going to confirm that my healthcare provider orders is the same as my MAR. So right here I have my healthcare provider order and my MAR. On my provider order it says Shirley Coast, 54-year-old female with a date of birth of 5/14/1964, and that matches here on my MAR, Shirley Coast, 54 female with a date of birth of 5/14/1964. So I know I have the same patient's provider orders to my MAR, so then I can go on and making sure I have the orders for the medications. So the one medication I have here is a Suppository sodium 10 mg rectal suppository, administered per rectal route, and then that matches here on my MAR too. So the Suppository sodium 10 mg rectal suppository administered per rectum one time for constipation. And then if the suppository does not work within 12 hours, administer a sodium phosphate 4.5 fluid ounce enema, and that also matches here on my MAR, sodium phosphate 4.5 fluid ounce enema as needed if no results with the 12 hours from the Suppository sodium suppository. So that all checks out, so then I can go on to using my MAR, enter the medication room, perform hand hygiene, and then I can start with my first medication check. Before I do that, I'm going to make sure I have the same patient bin with the same MAR. So again, Shirley Coast, 54 female with a date of birth of 5/14/1964, and that matches my bin here, Shirley Coast, 54-year-old female with 5/14/1964. So I can then start my first medication check. So that's that Suppository sodium 10 mg rectal suppository, and that's what this is right here. So I'll have that out, and then also I'll have that sodium phosphate 4.5 ml fluid ounce enema, and that is what this is right here. It's that enema. So I got those out. So that's my first med check, and then my second one I'll have to get gloves on. Because I'm going to be dropping a pill or one of these into a med cup. So again, this is my second check. It's that 10 mg rectal suppository. So I'll just drop one in, put it into the med cup, and then return that back to the patient's bin. And then I won't be needing this just yet, but before I enter the patient's room, I want to make sure I take in all the supplies that I'm going to be needing for the suppository. And so I'll be needing the lube for the suppository, and that should be, and then a towel as well. So I can then deglove, enter the patient's room, knock, use privacy, introduce myself to the patient, and then verify the patient's name and date of birth. So, hi, how you doing? Can I get your name and date of birth for me? Okay, so it's Shirley Coast, 5/14/1964. Okay, so that matches here on the patient's wristband as well as here on my MAR. And then I'll also check for any allergies. So she's allergic to codeine, and that matches my MAR, and I would also have the patient verbalize if they're allergic to anything as well. So before I go on with anything, I would I would tell the patient what we're going to be doing. I would ask them if they're in any discomfort. I would make sure that they are understanding of the procedure that we're about to do. So I'd ask them if they are uncomfortable, and they are. So then I'll explain that we're going to be inserting a suppository. I'm just going to have them lay on to their left side in a Sims position, and I'm going to insert I'm going to have them take a deep breath in, and then relax their sphincter, and then once on their exhale is when I'll insert the suppository, and then I'll have them relax, or I'll have them hold it as long as they can, up to 15 minutes, and then it'll work, and then I'll return them back to their laying position after the 15 minutes, and I'll be able to provide them with a call light and for them to call me whenever they're ready to use the restroom. So with that, I've explained the procedure to the patient, so they're ready to roll over onto their side. And so I have here a pillow to help them not fall off the bed. So I'll just have them roll over to the left sims with one leg slightly bent forward. And then I will put down one of these chucks. And tuck it underneath. And then with the suppository, I'll squirt the lube back into it, getting the bottom. And then I'll have the patient take a deep breath. And then with them on their exhale, I will then insert the suppository and then have them hold it in this position for 15 minutes and keep it in as long as they can. And then again, I'd have them, I would change gloves, I would perform hand hygiene, and then I would help them back into bed, into a comfortable position after 15 minutes, and have them call me with a call light whenever they're ready to use the bathroom. I would clean up the chuck with clean gloves, as well as clean the patient with clean the patient's rear with a clean washcloth and dispose of that per facility policy. And then I would make sure the patient's all good, everything's cleaned up, and I would then leave the room. I would chart, I would report any findings, and then that would be the end of that procedure. Fast forward, it's been 12 hours, the patient has not defecated yet, so we're gonna go on with the provider's orders and make sure to use that enema. So again, we're just gonna do a quick med check again. So I'm gonna perform hand hygiene in the med room. I'm gonna put on new gloves, and I'm just gonna make sure I got the same thing here. So I have a call for 4.5 fluid ounce enema as needed, and here is what I got, is that 4.5 fluid ounce enema. And again, I'm gonna have to take in a thing of lube. I'll take in a washcloth again with me, and I will also be taking a bedpan, a chuck, and a bath blanket in. Excuse me. So once I've done my first and second med check, so again I'll check it again, and then I will then enter the patient's room, knock, introduce myself, provide patient privacy. I'd make sure to verify the patient with 2 forms of identification on the wristband, which they've done to me. They've provided me their name, Shirley Coast, and date of birth, 5/14/1964, and they have also told me that they are allergic to codeine, which matches their band, and all of that matches with my MAR. So then I can then go on to explaining the procedure of the enema. So we're just going to put you back into the left sims position. We're going to have this enema warmed up. It's going to be a lube tip, and we're just going to insert it on an inhale, and then, or we're going to inhale and then have you relax your sphincter. Once you exhale, I will insert it and slowly push the fluid in. I'll have you hold it for as long as possible, or upwards to 30 minutes, and then once you're able to defecate, then you'll be able to call me, and I'll either assist you to the bathroom, or if you're not able to, then we'll use a bedpan. So once a patient's aware of what's the procedure, what the procedure will hold for them, I can then go on and start, and I will pull out and then I will also get out one chuck. That's all that's needed there. I'll have the bedpan down, and then I'll also provide a bath blanket for later on. and then I'll have clean gloves, perform hand hygiene once I enter the patient's room, clean gloves, and then once I will remove the tip of the enema, I will administer the extra lube to it, and then I'll verbalize to the patient that we're about to start. So I'd have them inhale, hold it in, and then on the exhale I would insert the enema, and then slowly squeeze in the fluid, and have them hold it and retain it for as long as possible. I would insert it from 3 to 4 inches, and then have them retain it. I would then pull out. I would dispose of this in the fashion of per facility policy. And then I would leave the patient in the left sims. And then once they are ready to go to the bathroom, they would call me back in. But I would leave. I would go and chart. I would write down how it went. I would remove my gloves before leaving. I would perform hand hygiene. Then I would go and chart how the procedure went. And then once the patient's ready, I would go back into the room. Re-glove, redo hand hygiene, and I would help move the patient onto the bedpan or fracture pan, and I would help rotate them onto it and center them. I would have the bed up at a 80 to 90 degree angle, as well as covering them with a bath blanket. I would then perform hand hygiene again and remove gloves, and leave the patient to do their business and leave them with a call light. Once they are ready for me to come back in, I will then re-enter the room, perform hand hygiene and re-glove, and then I would help and remove the bath blanket and help them move back over, or roll back over, holding the bedpan down so that it doesn't fall off. I would then clean the patient and dry the patient. I would throw the wipes into the bedpan, as well as the bed chuck, and I would document and what the feces looks like, as well for color, for odor, for the amount and everything. I would discard that per facility policy. I would then clean my hand or change gloves, perform hand hygiene, get new gloves on, and then help the patient back into their into a comfortable position. So once they're into a comfortable position, I'd either leave them laying down or sitting up, however they want, and then I would then be able to leave the room with them having their call light handy and calling me if anything is necessary, and then I would go and chart the patient's the findings for their defecation. And then lastly, we're going to be doing the ostomy care. So before I head in, I want to make sure that I have everything that I'm going to be needing. So I'm just going to take these off. And so I'm in the med room, and before going in, I'm going to make sure I have everything that I need. So when I go into the patient room, I'm going to be needing a new ostomy bag with a clip. I'll be needing a new faceplate. I'll be needing scissors to cut the faceplate. I'll be needing a 4x4 gauze. I'll be needing the ostomy paste, as well as the ostomy powder, some adhesive remover, and a stoma sizer. And so with all of those supplies handy, I'll be able to enter the patient's room. So I'm gonna go on that side. Okay, so when I walk into the patient's room, I'm gonna knock, perform hand hygiene, introduce myself to the patient, identify the patient again with 2 forms of identification. So it's Shirley Coase, date of birth, 54-year-old female with a date of birth of 5/14/1964, and again that matches my MAR. Shirley Coase, 54-year-old female with 5/14/64 date of birth. So I'll just put my gloves on, ask the patient how they're doing, and then I'll go ahead and look at the ostomy bag, only exposing what I need, and then I'll be needing those chucks behind here. Okay, and before I get going, I'll be needing the fracture pad as well. And so I'll have the patient's arm out. I'll put down 1 chuck here, the pad here, and then a chuck across the patient's lap. And so my first thing is going to be to remove the patient's old ostomy bag, slowly peeling back and making sure all the contents stay in the bag and into the bedpan. Make sure my things are all laid out here. And then once I do that, I can then remove the faceplate. And while you're removing it, I would then use adhesive remover as well to slowly peel it off. And that's going into the garbage. So that would go into the garbage. And then I can then clean the patient around, and clean the patient's stoma. And then I would then use, once it was cleaned, I would cover with a 4x4 and then measure it to the correct size. So you want a 1/16 to 1/8 of an inch border. So we're gonna do this one, cover it back up, and we're just gonna measure that to my faceplate. For video purposes, I've pre-cut this one just to save time. So I've got it cut out. So then I will go ahead and, before putting it on, I will put the Adapt paste around the stoma, and then I would put the Adapt stoma powder onto the stoma to so that it isn't getting inflamed or anything, so it doesn't start burning. So I would just simply peel this off and center it over the stoma and put it on, working from outside or inside to out, not pressing too hard, just making sure it'll hold. And then with the new stoma, or with the new bag, is when you will really put a push on it. Just making sure it's sealed all the way around. And then I would discard of the old bag and pouch per facility policy. In between taking, or when I took the old one off, I would have changed gloves and then redid hand hygiene and then put on new gloves and then put on the clean stoma and then cleaned it and then put on the clean ostomy bag. So once this is all thrown away per facility policy, I can clean up my mess in the patient's room. I can make sure that they're feeling well, they're positioned good in the room. I don't need anything from me, and I can go back to the nurse's station and chart. And that is the end of the skills video.